Hey everybody, it's Dr. Perlman. Welcome back to the channel. And what I'd like to do is take a minute today to talk about misconceptions when it comes to how to treat, care for, rehab, eliminate back pain. And when I talk about back pain today in this video, I want you to really understand that we're talking about people that have really problematic bad back pain. Usually it's the lower back. Sometimes you'll feel like it's the mid lower back. Sometimes you'll feel like it's your butt or your hip. A lot of people misnomer and say the hip, which is in the front, but they really mean their sciatica area or their buttock or the side of their SI joint, sacroiliac joint in the back. And that's okay. But what I want to talk about is understanding why it's there, likely, what to do about it, and how to do all the things I alluded to, or that I first touched on in the beginning of the video, which is how to quote unquote heal or manage it. So let's talk about that. Number one, if you're in that much pain and it's really debilitating, you're having a lot of trouble falling asleep because it's throbbing. You're bending down to pick something up and it's just really agony. Bending forward is scary because you feel like your back may or has in the past gone out. You can't really go to the gym or lift weights. A lot of weightlifters this happens to with deadlifting, and you actually think that it's bad form. A lot of it is really fatigue. The tissue is just too fatigued and taxed, and then eventually that disc goes pop, and we'll talk about that. So when you are one of those people that I just described, or really fatigued after a run, like the back just is killing you all day after a run, you walk all day, maybe you're in the supermarket, maybe you're walking around with the kids, maybe you're at work, even sitting, but then when you stand up, it's just killing you in the bottom of that lower back, that sacrum, tailbone area, and your butt's hurting, all that stuff, okay? Takes you a while to kind of get walking around and feel good again. All that pain is coming from something that is very likely, now I want you to listen out there, haters, it is very likely coming from something that's called stenosis. What is lumbar or lower back or lower spine stenosis? You can have narrowing stenosis at any level of the spine. You can have cervical stenosis, usually much more concerning than lower back stenosis. But lower back stenosis, whether it's central, which means in the midline, near the spinal cord at the bottom, or go around things like the lumbar plexus or the sacral plexus nerves, which is concerning, or what they also call IVF, intervertebral foramen. That's a fancy word for hole in the side of the spine, lateral to the spine, where the nerve root comes out. That can also have a level of stenosis or narrowing, where it's squeezing off a nerve root. You are very much likely, in my professional opinion, as a chiropractor who has been around chiropractic for a very long time. I have a degree from University of Rhode Island in exercise science, and I have a doctor of chiropractic degree from Parker University. In other words, it took me about 7.5 years of collegiate, and what is a doctorate level? No, excuse me, not doctorate, postgraduate level degree of chiropractor to have a ton of advanced anatomy, physiology, and neurology type courses. And I can comfortably tell you through clinical experience now, 5 years, that it's stenosis. And what I mean, and again, to really hammer this home, it's not just because you have a herniated disc, which, by the way, if you have a herniated disc, depending on how much space that disc that's herniated or the disc that's bulging and herniated, two different things, take up space, that's narrowing, that's stenosis. If you have what we would call like spondylosis, which is something like calcified bones and or like a little arthritis or spurring of bones, narrowing of disc space all around a, again, joint in the lower back in this case, that piece of bone could be starting to narrow and get really thick and cause that narrowing or occlusion around a spinal nerve root, causing narrowing stenosis, okay? So if you are one of those people for any above the mentioned reason that stenosis or narrowing exists, that's when you're gonna start feeling those types of symptoms, okay? So how concerning is this / what should you do about it? Well, here's the deal. You should find a chiropractor who is very skilled at adjusting to where when you are getting adjusted, you immediately feel some sense of relief. Does that mean you're better? No. Does that mean you're cured? No. Does that mean you're healed? No. It has nothing to do with it under the circumstances that I'm describing to you about your debilitating lower back pain. I'm saying that you need to find a chiropractor that listens to you. Then you guys build rapport. It makes sense. And you don't feel like you're being ripped off. You don't feel like you're being sold something you don't need. You know what I'm saying? And you understand that there's a trial of care in anything you do. I mean, getting injections, going to physical therapy, and getting surgery is a trial of care. It's not healing. It's not, at the end of the world, whatever, no, nothing. It is a trial of care. And that is exactly what I'm explaining to you right now. And with that chiropractor, you want to make sure that when you're adjusted in and around the joints that are affected, sometimes you don't touch the one that's affected. Sometimes you don't touch the ones that aren't affected. It's all about experience and clinical skill and trust, right? And doctor-patient having relationship and having your goals in mind, and then the doctor's expectations in mind based upon your goals, and then getting to the crux of things and feeling a little bit or a lot better, and then building in that wellness or maintenance. So we just talked about what it likely is, and I think huge percentage of the time there's an amount of stenosis and that bad lower back pain. Number two, what do you do about it? You find a chiropractor that's going to be the most accessible, the most affordable, and the most natural. You don't want to be pumping steroids in this thing with injections all the time. That is proven to deteriorate tendon, ligament integrity. That is proven to absolutely make a joint start to calcify and build up more scar tissue over and over again, while it's just masking and reducing inflammation, right? So it's masking the symptoms. Now, some people, and I know there are some orthopedic and neurologic doctors that have big followings on YouTube that think chiropractic is just about treating symptoms. Well, yeah, when you have a disc bulging and you crack the joint, cavitate the joint, you are kind of treating symptoms there, but one, you're doing it naturally. Two, if you do it right, you're actually beating the pain gate cycle, okay, the neurological components. You're actually inhibiting the nociceptor pain receptors, which inhibit something called the pain gate cycle, and you're actually beginning to kind of heal the joint through the process of the brain to body back to brain neurology. It's detecting that there's some healing going on, and it's giving what we call tribonucleation. That's that cracking on a deeper level in the intervertebral foramen, in the disc, and in the facet joints. That's actually making a little bit bigger space there for those joints to move and breathe. That's why you have increased range of motion and reduced pain following an effective chiropractic adjustment that's leading to some semblance of healing. But did I say that's healing? Did I say it's wellness? No. I said there's another component, and I said we're going to talk about what it means, how to completely sort of treat it or heal it, and what the future looks like with that kind of pain. And the last component of that is you have to use that chiropractic and the tools that chiropractors have, such as shockwave therapy. Oh my God, you're on this channel, you're gonna hear about shockwave therapy. And that is going to reduce scar tissue, desensitize some areas on a deeper level, and then you have to get functional. That's where the progressive active movement comes in, and that's where you're gonna get into some of these gurus on YouTube who are either selling their PDFs or plans or rehab your back at home, get rid of your sciatica at home. I mean, it doesn't happen at home. I mean, it can if you're not that hurt. I mean, if you strained a muscle at the gym or you strained a muscle throwing a baseball and you're 18, 25 years old, whatever, I mean, you're gonna, probably get a little bit better. Remember, in the beginning of this video, I said, if you have really terrible back pain, you have really a lot of trouble falling asleep, really, doesn't calm down until you're on a heating pad or maybe use some ice, really a lot of trouble sitting down on the park bench or the restaurant bench, and then you get up and move around, whatever, every time you pick up the kid, okay, going down the rabbit hole, don't want to, but that's back pain. And then going up to where I was talking about now, those home programs, you've got to be mindful of just how much time it takes to build a progressive motion and progressive loading to these joints to be able to tolerate it and then heal. Because here it is, in the words of Knees Over Toes guy, Ben Patrick, how do you heal a joint? Compression and motion. Okay, there it is. Whether it's a chiropractic adjustment, compression and motion, or whether it's carrying load, progressive in motion, through a really great, well done analysis by chiropractor or other provider. Look, if you don't want to go to a chiropractor, you'd better find a physical therapist or kinesiology kind of person or I mean, maybe there's an MD or a DO out there that has someone working as a trainer inside the building that's that brilliant. Because I'll tell you right now, it's user error, guys. You go to someone and do shockwave and they start waving that wand all over the place, you're not going to get better. If they understand how to build up the depth and the amount of the impulse frequency done right in terms of how hard that bar is hitting and that mechanical impulse is stimulating based on whether they're trying to stimulate healing or whether they're trying to like break down scar tissue, or how many millimeters or the angle they're off on where like the disc is irritated, or whether or not it's even a disc problem or just scar tissue that's residual post-surgery, works great, okay? But that's what matters. You've got to find the right provider. I love Stu McGill, Canadian mustache. I love Stu McGill. Do you know why? Because Stu McGill says that his intake, when he does an exam on somebody, and they're usually those people that are suffering terribly with debilitating pain, takes him a good hour, hour and a half. Sometimes I've heard him talk about consultations, I think taking like 3 hours. Because you cannot see someone for 10 minutes, be like, that's what's wrong with you, and we're gonna start you on injections and exercise. Or, okay, here we are, can you see me? Good, it's coming in through Skype. Oh yeah, man, I got my screen up, we're doing a Zoom. Yeah, okay, it's a $3,000 home care plan where you're 100% accountable. Wait, what? Yeah, go over there to the couch and start doing cat-cows. I mean, that's nuts. I mean, if you're a fool and you want to do something like that, that's cool. Maybe it works. Then you're not really that hurt, because I'll tell you why. Here you go. Ready? Free secret right now. Your back hurts that much all the time if you're not laying down on your stomach and decompressing to where it begins to ease, and then you can do what we call crocodile breathing. In through the tummy, fill up that diaphragm in through the stomach first before it hits up here. Through the mouth. In through the nose, out through the mouth. Breathe in the flowers, blow out the candles. Breathe in the flowers, blow out the candles. There you go. If your back feels better coming up from that, boom, you're welcome. Merry Christmas. But a lot of time, the people in the worst condition need everything that we've just talked to leading up to this point, which leads me to my last point, because you out there that is feeling that hurt in your lower back and struggling and wondering, you're scared and maybe you need surgery and all this stuff. Aha. When do you know if you need surgery? When do you go to the doctor and they consult with you and suck out the disc? When do you go to the doctor and do they do what I had, the Dremel tool, where it's like, oh, there's not enough space here. Boom, open up more space. When do you get a fusion? Let's talk about this very briefly. If you have tried conservative measure, 2, 3, 4, 5 weeks, whatever. I'm not even going to be the guy that's like 3 months or conservative and then it fails. Document Blue Cross Blue Shield, No, 3, 4 weeks. And you're just like back to square one, and it's just not going to work, and the pain is that debilitating, and you have the MRI and the imaging to prove that you've got the stenosis. I think surgery is the answer. I do. I think surgery is the answer. There it is. I said it. Chiropractor Dr. Perlman, he said it. And you just have to get the right surgeon. The same way you found your chiropractor, find the right surgeon. Rapport, trust, have logical reasons behind how invasive. Are you going to do the least invasive? I say always go for the least invasive procedure, always. I think it's too high risk to just walk in and say you're going to get a 360 lumbar fusion. But a lot of times, a great surgeon, especially ones with a ton of experience, are going to be like, I do this in my sleep. I can trust you that, and I don't want to see you have to do anything, whatever again, based on the severity and the integrity of the instability. One of the reasons I didn't have a fusion was we did flexion and extension, lateral lumbar x-rays, and I didn't have that joint instability. I might feel unstable, but I didn't have the joint instability to warrant that it must be fused. If it was fused, would I have had as much pain coming out of surgery as I did? I don't know, probably. I've seen plenty of people with cages and screws in on the wrong angle, and there's still plenty of pain. So the fact that I don't have any metal in my body now, and it took me still a year to get over whatever pain I had to the point where I'm finally beginning to feel like I'm truly healing. It's another thing, guys. Give yourselves time to heal. But as I'm talking about, very specific a group of people that have that kind of back pain, what it will take, and then I just said, if you're failing with your conservative care through 3, 4, 5 weeks, go consult a surgeon, and you probably need surgery to open up that space. In the words of Stu McGill, where do surgeons shine the absolute best? When they're doing lumbosacral foraminotomy or foraminotomy, laminotomy style procedures where you're getting like either a full laminectomy, decompressive lumbar surgery, or partial where they're getting in there and opening up space for the spinal column and the nerve roots to breathe. That is proven. I can attest to it, okay? But does that mean, oh, well, I got some narrowing, chiropractor can't help me, I'm gonna go get surgery now? No, I've seen plenty of people with spines that look horrible. We give them a few adjustments, their lives are seemingly changed. I went almost 20 years with conservative, is that true, 20? No, I went about 14 years of conservative chiropractic care before I finally said that enough is enough. I had to get the surgery. And at the time, thank God, I was able to stash a couple of bucks, fight with United Healthcare. I had like one of those sub-United Healthcare plans or through United. It was like another company or whatever, Freedom Life or something. And I went crazy setting that up, and it was almost not going to be covered. But through perseverance and utilizing the right portals and speaking to the right people, we made damn sure that even though I had to pay over $12,000 out of pocket, that's right, I had an $8,000 deductible and I had to end up paying about $12K out of pocket, I got surgery that I needed, rather a lot better than being, $250,000 or whatever in debt or someone, out of network. My surgeon could not have done the surgery because he would have been out of network and the hospital didn't take it or whatever. And I don't want to see that out there for people. So you got to do your homework. You got to find out who the surgeons and the doctors you consult with, who they recommend you're in network with. So you can, even if it costs you a lot, if you see something coming, obviously, be wise about what you're saying when you're setting up, insurance plans. But it's not like we're talking about cardiovascular disease. It's not like we're talking about cancer. It's not like we're talking about brain tumors and things of that nature, guys. We're talking about lower back pain, the difference between walking and not walking. We're talking about the difference between picking up and playing with your children. We're talking about walking the dog. We're talking about going to a job that depends on labor so you can put food on the table. That is why you want to be in the best possible spot to take care of your lower back, the absolute best. And if that means being ready to consult a surgeon at some point based off everything we talked about in this video, then you got to be ready. If that means that a chiropractor, I'll tell you right now, if you come to me and you're a patient with some of the worst back pain in the world, it's not going to be long before you realize whether or not you're a surgical candidate. That's you know what I'm saying? And I'm not saying that to brag. That's not a braggadocious thing. What I'm saying is that it's usually a pretty fast funnel. You're not going to be waiting, 4 or 5 months of conservative care for you to be like, I can't believe I wasted all that time and money. Not here anyways, and I hope it's not anywhere in the world. Because the reality is you've got to put in the work to get feeling the best you're going to feel, to get that stability, to have progression, and then eventually active, loading and motion, right? We talked about. I always mess this one up whenever I'm trying to say active weight bearing motion, blah, blah, blah. And I said, Ben Patrick, how do you heal a joint? That's what I was going to say, is compression and motion. To not have to worry about getting up from a chair and it just absolutely destroying your life. Okay. When you can have that compression and motion and you're stable, that's what we call healed. Healed doesn't mean no chiropractic forever. Come on, guys. Would you stop taking your vitamin D? Would you stop taking your aspirin if you were a little inflamed? Would you never, pop an Excedrin for a headache ever in your life? Would you never go to the dentist again? I mean, come on. That same oral hygiene that you use for the dentist is the same, or that you should be going to the dentist for, is the same commitment you need to a chiropractor who understands you, knows your spine, knows your body, build rapport with, adjust well, is maintenance in the future. Your lower back. We want a strong lower back, you want a stable lower back, you got to move with kettlebells, you got to move with glute abductors, you got to move with bands, you got to be able to tolerate going for a little bit of a run, you got to get in and out of the pool. You know what I'm saying? I mean, that's what we do. Again, hunter, gatherer. You know what I mean? Human being, bipedal, mammals, tribalistic in nature, okay? Community, productivity. I think I made my point. That's how you do it. All right, you have any questions, feel free to reach out. This is Dr. Perlman. Merry Christmas. Happy holidays.